Meka say ahodo mienu either through cesarean section and through V-birth, vagina delivery and vagina birth. Too. The normal route no. Menka say CSE abnormal, but the name say enka I was say fat ne vagina. Yes, please. But we only conduct CS or perform CS only when vaginal delivery is not possible or feasible. Okay,
so let's say for now, you have 2 ways, and I say, oh baby, I will 2 ways, or bet me dear deliver. And it says either say be through CS, just say be the second canal, and also one casa sebi or one fancy. Okay, I didn't show up. We will continue from there. But number see about ABA na ABS pen say be a sebi or baby a chibi, na say and some baby on my papa to me but one year who say either by CS or normal delivery. No, let me come to you once again. Na nkawodi we no, but yana be say fan kakraka na ma ya hwefo etime hono. Now, having made us know say through either so no abewa fanase and now say through CS, now we are focusing on the CS cesarean session. No, at what point and our bar when you saying wafa more can say trimester wafa for weeks in months in a mo akwa doing pen so then a bema doctors and answer more as suggest say the other they just say be the second count and I say CS.
Now we conduct CS based on 2 issues. Either say a elective,
okay,
and I emergency.
Okay.
Yes.
Elective needs a election.
Make elective. There may patch and say one kasana we decide say obey CS.
Okay.
If you are looking at a new ma unyama ufem, any the we are ube pelvis no a different.
Okay.
We have the female gynecoid pelvis.
Oh right.
And this female gynecoid pelvis no. On say aha no I say ligaments wa aha ligaments wa aha say ligaments wa. So getting close to pregnancy no, your hormones be a bit agro. Into these hormones no, they act on these ligaments. Act on these ligaments. I'll be huna emune baby.
Okay.
Emune baby, and I just say acquire them into better or do ne timer or be wa ne nanti ne shada anya papa or nanti kakra say wa lucky. Yes, and kase ni mwe baby because oba okita normal pelvis be ya ne kase mu ye ha.
Okay.
Enti bia no obi nkita sa gynecoid pelvis ni. There were so many types of pelvis. We have the android, android pelvis, it is a bema pelvis.
Android.
Yeah, android. And it is a mema dear. And anthropoid, platypeloid, gestomino, we have the negele, we have the roberts, we have a lot of pelvis. The ideal pelvis for women, the gynecoid pelvis.
Okay.
Now with the gynecoid pelvis ne kra no mpono. Sa akola no obano oso sin wo pelvis na. Eno ground case me wo normal pelvis inti. Chinchina was me wo fa. So we have CPD. CPD is cephalopelvic disproportion.
Okay.
Ye ka cephalopelvic disproportion. It either say akola ni ti entimi nra madani pelvis ni mu mayen wo no ana say pelvis ni swama akwala aniti. That is why in every pregnancy abra wo ba be wie pregnancy and I say enche labor be setting we do a EFW and AFI me can EFW we do the estimated fetal weight.
Okay.
Into estimated fetal weight ni yehwe akola ni weight or day ba. If ni weight ni yehwe na say entimi fa pelvis ni mo e na obekasa. We do the AFI, that's the amniotic fluid index.
Okay.
Yes, I'm so sure you wa akra no. Obo wa na funu so. But akola na oba no swa. Enti na ye AFI na e be kire so na je say nsuo na amama na yefunu. Ayekese ana say ebi amame na nkasa owo condition bi a ama na funa yekese. So we do all that. Now my main can about the emergency. My can about the elective. Obin so share madam for back say you were your dilatation board. Board buy the trail. Say was in there was a be up to 10 cm. 10 cm now was a be no. A be back one back on ye. A be me and but I word the way at no. Would do one pain now be feminine. Would do two and I'll be who so not just a one pain a crown, nay, grow. But what do two nuns where you were your parents would do three? Also, I call him and come a pain back on. Would do 10 put their one shall back a canyon, mamma. I had to madame back or say, dear Yanni. A bufu cry ye board na ya de be do no on hano ho kra e ba ya no akoda ho aye CS obi so ho hwe na nya ade a ono ahwe ne ho a enya ade obetumi afa sa ya ono and then we have the omo yetietia
okay
obi o yetietia ni shoe size about 3. Yes, we shoe size size 34, size 35. I ain't me my own fawase because we presume say pelvis ni nya adequate say ebe crab ebe ma eba fem. It is short stature. Yehwe. Efin so bi owo multiple myomas. Omo ina no is elective for them.
Okay, me pa chonti yenya botre ne mpeke no 11. Yes, so no o me hu say CS no is either say nipa na ankasa ebe ka say media me CS the reasons no vary and say bi a nipa na betimi akasa o aka no endure the pain minti me ya no and obi nsusu so no e bi a ono ase saa na mepe no on be so be wo se be afa na se and ono nsusu be ka na saa and obi won so hwe no ho a on say minti me enko no ma hodo na wo mu na ano de ma no se nipa na ankasa na elect say obaso aye ne saa na menim se bia wo kasa no me se menya ne ya me se meti ase se bia apart from election no de ye se mo so mo suggest ni bibi we mo abofa na kese enso ba kire no ma me na decide na won mo na mo decide
ma sure akra ne kese no eno no me can say a emergency. Okay. But me can say ABI is part of the elective because I don't know a bedu on a share where who's a crown or banos. Emergency comes in. On the emergency there is some plant. I dare be to me see. It's a be a madano where to me endure pain abia where do abia 7 cm. If it's 7 cm now where do no. There is severe contraction, but there is no cervical dilatation. There is no cervical dilatation, and the Ampajani say, "You're from a cuckoo." Contractions no a pain and wording. I wasn't canasino, a to me be, but I seen into me be. Just say, why stubborn? Once wapem. And sometimes ebia mother no timu se we de wabre oyehwe enyi and a baby edunu yamfa na nkwa it's either we are going to lose the mother or the baby or both. Into that is the emergency. And no de eba ne sa ya pem ye ho hwe enyi yi into ye no ye no kasa 1 2 now yes obema a tough timer we will send you to the next level. Because obi a hospital be anywhere ope maternal mortality. Hospital be anywhere ope. Enti ene do emergency ne pe ye hu say we yanya ye be lusu mother ye be lusu baby or both no. Ene ye no kan 1 2 no 1 pen ene ambulance no say we need kakra ye doctor ba ko Dr. Nida kududu baby a wo bi anya mi shra na oya ade say chese patient ne ba ne ye hwe na say ye emergency obi wo wa ne be ke ni knusi oni ambulance ka obetu asisi amom de na ko the next level. Yes nti emergency ya ade a ye nsusu na ye putupru abem na wo se ye fa kwan bi so ne deliver abofra ne ntem and time before the uncertain happens but planned ne de that is elective no eno de no ya plan ya to nti onipa no kra to me beda ho
Okay.
Na ya de chia ya man.
Wow. Mesa ba ho for some questions me, but me kai ahwe for say obetumi ajoin ye nkomo ya ekoso yi your WhatsApp number that screen so 0246678546 send your dial screen so 0246678546 obetumi ajoin ye na bi so obetumi ajoin your Facebook HSM TV Kumasi Ghana or Heaven Seekers Ministry Kumasi Atonso Dompase na mamenfa akonya we so na ni die mo a memmo ya hwefo nkai titiro na o hwe Facebook na ebia na nansem no HSM TV no opa onya 1 or 2 enoma binti twase o hwe o frequency no ema yenti say na bia kane no frequency na eda no onya me pa cho e say current frequency a ye use no 11635 and symbol rate no de no 30,000 na polarization so your V no anti frequency no and besisa 11635 temperature and also obetumi afa processing mo aye blind scan no and also obey sa search no onya ye search ne pe obon so obenya HSM TV na one abum edi djuma no ewade onhira opa asene maka no yekọ yenim na yebebi ahomatum ama the opesa ofre can be an wafra kantine die mo for now no the WhatsApp number na mayemfre the mo yebebi ahomatum ama wafre na so the asha see on the issue of CS ye hwe ansa na oba beko akoye CS anase be ni CS bright CS na koso ana bi onso CS na chi the twase ye yo no nyina ho nkomo na ye di mebisa ma menes se ema nkasa kura o ma wo no kwa hodo sense no timido o me hu se by 2 weeks na yetimido is either say bi oba na sebe obewo afa na se anase ye betwa no ebe ni CS na ye yi abofra na CS no na ye focus on this evening so much. We are dwelling on the CS. She has made us to know that CS comes on board when a patient Nankasa, the pregnant woman, elects that she wants to go through a CS cesarean section. Then that one, yes, is her prerogative. And you know, they will do it for her. And now say when it becomes an emergency, whereby Obano. They are trying to get dilation and everything. Senebea should be able to deliver through vaginal process, but still unable to do so. Now probably na children are distressed, so they will now elect for her. Mobile choose one and say you very serious, at the amount. Then they pick it from there. Now midwife patch me buy her. So one year hon send city on CS no de ebema ebe prompte CS emrem either say patient now ba wonyem no ono abeka say baby mintimi mfa ya obi emu entimo nkutwa na monya abofra na say ekoye critical emergency momonim say baby adru no de aha ma me no be free ana abofra na so mumu enu na be free munti no etwa se mo bon kwa no ho ba ntimo be to ama no so we do just yitwa na yi abofra no na ogituma makwakwa yenyesa apart from a pacho emergency no and I say apart from infant say oba na mo hwe se 7 kana sibe bi na emie na kodu bebi mo se no ho mete no is that the only emergency or the only condition a prompt emergency ebema mo beka se yenye CS and I say the other conditions are a bit me ama mo decide say oh baby adu ni de ehwe condition e na bia etwase ko CS.
There are other conditions where that the factor me shasi and na was saying kamishira peniful with your mon fanche me na make say me there radiase e won pempen so a odi me adu any said the program you call Yeshua ni din kese efe me kase nyame Yeshua daddy nyame Yeshua mommy baby omo wo bia minister Philly nyame Yeshua omo na nyame Yeshua ebusua no me mama Pam mama Golda me papa Pastor Enoch mama Naomi mpacho obi biara nyame afa wo so se fame babia nyame Yeshua papa efe crew no mishra obi a health team nyame Yeshua obi bia ene ahwefo Efi Madam Priscilla Adom Nyamishra pa Wisconsin or your lecturer or Wisconsin Nyamishra ne pa and I'm about Teresa Nyamishra ne pa yeah enti mpacho said ya obisa no eto de bia na onipa no onim se obetimi awo
okay
eti in the course of we no enye na ase ne nko a emie no but enyo maybe do na se na emie a wose yekoe no but enyo maybe na de ne ho ba jijima na se ne ntumi mbi
okay
ebia in the course uterus na contract no na uterine rupture bem
okay
uterine rupture bem na chese awode na pai eno de nya afianse ye be delay e wo see etumika because whenever there is uterine rupture uterus no the way so na ye highly vascular make highly vascular na chese moja die fusani enti wan hwe ye pai a ebetimi asepie egu ye funu no mu a na se pai a midwife bia be hu sa pai because on say baby akola ne da no o papa ti abehu ne part ni bi but obed awode ne pai na obeda ye funu no mu a o papa ti a o feel body parts ne more than say o share uterus ne mu and if there is rupture no dear e was see etumrika edeneko yes and efin so ebia ye hu say going on ye hu say akra ne hu miensesi asesa akra ne hu miensesa sesi adia because if the liquor is in fact the liquor is supposed to be clear
okay
but if there is any color and any discoloration I was
like on
nsuo na egu abofra no
okay
it's supposed to be clear, it's supposed to be warm but in a case we are getting meconium stained liquor na just akora no nsuo na efi ne ho ba no hwa ejanan wo abra akola ndi ne tiba if sakrande ne to na eba obesusu se ebi eno kranye ni na yesebe na ode ne to ba nti wakọ ejanan agu nsuo no but ode ne ti na eba ni ti hwe pelvis ni mu na se wakọ toilet agu nsuo no mu a it should tell you that we are having the fetal distress nti ense say
abofra no hometi
akra no hometi ya nhwe ya yebelusu abofra no akra bi nso wo ho a in the course of contractions na if you be say mother na contract no mother na contract bi a wo check FH na say FH na drop
FH na dey
FH na fetal heart rate akora na ko na edit akora na heartbeat
okay
ebia na bibia chechire ne contractions si pe na de ni mia no enti ni na ya de ya ko inside ye kwa ye kokohwe nti obi wo wa no wa plan se oba be ye birth obe wo afa na se but e bia na nneoma ankoba ni obi de oso on de obe wo afa na se eyire so no midwife ba ko eyire so no anokofa nneoma ba say ye prepare no yes please
yo we pacho mama me say question we on see na ma ye tete nsem ene adenti mama me say bia say de mete ye na mantini ye dia because when me ho say bia obi na wode na rapture so yes no be na asa abofra mo check bia na heartbeat no mo say bia or break jama baby kwa chiche no kontimi home na bi wo so no e bia abofra no de nti na eba na nsuo na gina abofra no ho no e na bi wo wo mti say bia sabe abofra na gina bi wo ma na say no so e bi wi mia no na ma e koso sa e pa cho mate se ma me bi when say o kona nim bia na 6 months 7 months mo na fe na pressure kosoro pa enti ko wi say doctor say da bi dia o de ya o ma me no pressure si kosoro no anha na won kwa ho akanti yenkotwa na yenya abofra na nso timi ko basa ana mantine ye
mpacho yesa na tie and na me group is ade no
okay
me can say ade ma oba ko wie CS we can talk about the maternal aspect the fetal aspect and then the placenta aspect
okay
enti mame yenka maternal aspect say sure. If the mother is having a condition like a HPT sorry me use your terms like the hypertension hypertension ye wo mu ahodo
okay
obi wo ho a no ni hypertension nyinsen ne baaye no edu 20 weeks iko na hypertension de so we have gestational hypertension we have obi a no wo hypertension ne dada
okay
ena nyinsen ne baaye na aye dey amana kosro. We have hypertension superimposed.
Okay.
Any what gestational hypertension. Obisu wa hypertension ne penowo. But only protein in urine. HPT wo hypertension now BP costrope. The next thing I hear and say Yeshua Johnson.
Okay.
We have a condition like eclampsia and preeclampsia. Say eclampsia ba na se when treating ye na sorry se preeclampsia ba na ya nhwe ho dwuma endi na se ekowie preeclampsia na ekowie eclampsia na nkasa ye ni option. And no, we have to take the pregnancy away, irrespective of the gestational age.
Okay.
We see ye free honor.
Oh, no, sir. In the HS, yes, in Punya Bofana, but you are saying,
yes, a baby, a baby, no.
Okay.
If say be a yin were 20 weeks, I was 6 months, not just say yes, because Ghana, they bet to me, I share 7 months and above. And she said, I was 6 months, they are not just say. Ye know every home because you sure you will lose the mother. You lose baby now, mother is there. And I know be na onya crandu age of viability. Into no mother no ho. But if say you lose mother no, na baby no soon do age of viability na ye jai baby ne say no nti on mature kakra na just say ya anya mother no yi. Na even preeclampsia no so we treat now hwa na hu say the way I me treat cry still enko ya still I was see nyinse ne frio BP ni issue no matter the kind of max sulfate I would my patient max sulfate here adrena ye the control preeclampsia no what money na still BP ni issue to and issue to we have to get rid of the pregnancy.
Okay. And in this case, you know, for an say ABA BP, you know, more try to control it, you know, but Ghana age, you know, and I said months, you know, so do 7 months, you know.
Yeah.
That's about saying 33 weeks, right?
No, 28.
28 weeks. When you're fancy because when you're 30 weeks, so time the movie you are going to abofrano. So we are wabofrano, yes, sir. Through CS. Okay.
You bet to me, I want it through CS. Now the aim is to get the baby out. So whether V birth or CS, but in emergency situation, yes,
okay.
Yes,
okay.
Into onu ye na ye nebe koniku. Nurses are there, pediatric nurses are there to cater for this me fancy neonates. Into obey kakra just a mother no better na ho kakra che.
Niku ni ye de.
Niku neonatal intensive care unit.
Because ko show kuni fana bra. Niku die. Okay, now somebody no ko ba bia e dia bo friend to be incubator no na ye hwe se na bia obetimi agina nyesa. Oh wow. Okay.
Yes. And a mother nso our condition be to say heart disease.
Okay.
And also yen kase mother nko into labor. No, eno emboa. Mother no gestational diabetes. Ebi ono ano ni diabetes dada. But onyem ye na diabetes di ne ho beji mu ana say no wo bi. En onyem ya asan ye kese. And diabetic babies na ga so omo soso.
Oh, okay.
Eti omo no kra ya nsheda njeje omo ani wa V birth mu. Omo na obehu omo so omo sopa wo omo ade a fine omo ye okay. One hwe na one check omo glucose way na wo de omo koto so akre da we an ho ye fe one hwe abekọ no wawu da ho.
Oh.
Yes, please.
Wow.
Oyefe also but because ye na finima na ne ma me wo sa conditions you have to be checking the glucose frequently. Na baby o here fancy glucose no the man baby here no for no the man.
Okay.
Yes. And then we can rupture. Now when there is cephalopelvic disproportion, say akola mpacho menye demonstration. Yes, please. Akranitini. The baby always comes in attitude of fleshing. Omo da ye fuma say no mote. Ne ti patania ne nsanu gu ne boso ena ne nan no egu ho sei nti ene odamu sei nti ne ti ena ode ba na ne ti no ode ba sei no yen fan say maternal pelvis ni nti won say ne ti no ode ba no wey ontimi fam yen fan say ontimi nko nti kona ontimi nko no wontimi chese waye bibia wo hwa the head is high. When you have vaginal examination, when we say cranity was high, irrespective of the good contraction. Irrespective of the good contractions, still aqualanity and cervix can dilate, but aqualanity was through. And as a cervix is not even dilating, you say the bovium. It's that's our cranity, as we say, mammy, ni pelvis. Now, pelvis ni swap. Emma, aqualanity.
Oh, the metinibia. Hey, me I am the bad and then by Papa. I say, my idea.
Yes, Obinsu wa the pelvis on whenever Obi call hospital, Obi call antenatal for the first visitor. Most of the time, the midwife share nyoma bibri or share nyoma bibri. Maame ne ba no hwe ne gate. Me can the gate a hwe ne from head to toe. Hwe the wi or nanti. Ebi oba na otogu ne nan so. Ne nan na otogu so ebi a na oba na ne nan pema de. Probe into why a maame ne togu so no. Ebia na maame na nya accident bi pen it affecting the pelvis. Wontimi nkoka se sa maame ne wonfa na se. Yes.
Wow.
When you injure your pelvis no soda. Obi so why ya ne surgery your pelvic ne soda. Wontimi nka se maame we wonfa na se. Enti ni na ye hwe. Enti once
me pa cho de oba no na bia bibi nti e pa no na ntu si fom. E na na hoye ne ya no so.
Oh, eno de only problem, but I say all banner and a baby
pain no
pain no okay. And no cry de yeah, ye to me obet me amana just be or ye free and yes, almost so be togun and nine so be sunny the or togun and nine so na bisan subsequent deliveries.
Okay.
Obi one or poor obstetric history. You can't poor obstetric history. Na womu ebia ono a oye obi a debia ye ni CS. So because ye ni CS penya bisande nti ye ni CS.
Okay.
Ebia na sa abofra no nurse. Enti na ye ni CS but ebia wo hwe we no abofra ni so.
To betumi
aba. And obi nso wo na womu na CS nkwa na ya ye no. Ya ye ni CS 2 times 3 times. Untimi ngaze sa nipa nsan enko VBET no. Especially more 35 years and above, put their precious babies, put their yen frekra say, mra for VBET. Akrebi so ho bano, nimfruma no. Nitino de ba say no. Nimfruma ne danitino. Enim. That's called presentation. Nimfruma na beto ha. And I want say nimfruma na join the placenta no to the mother. Enti nimfruma na abeto ha no ya goguru hu so onko wo mfa ho na ni tinisi eyi ne so a cord ne so a e dey assemble ba because a cut blood supply the moment a contraction be set in a cut with oxygen supply enti if ya akora be hu na ne hu mieti wo be check e fetal heart rate na ne nam 110 na ne nam 80 debi efin so to le bi a we are making na make say bia na cord no edanity so ebi okra hu cord no vulva ni mu cord na pie nti no de ebetumi aya na say ye de warm saline ebe kata cord na pie akra na o hye from cord na pie ni na mabonten.
Wow.
Nti no what we can do ni say ye de warm saline ebe chichire hu nemum ye tumika akwa deliver maame
through CS.
Through CS.
Wow.
Yes, please.
Encourage so dear. Na baby from my boy don't be pia. No be agwana.
Yes, sometimes especially when there is long cord. On say from wa anase yeah. It's me sleepy efa baby. Now menka fetal side where maternal side now because now with the fetal side
there's a normal if free abofra no fma ebema yakakase yenko ye maamini CS
we can look at the malpresentation.
Okay,
make a malpresentation akra no e was enko basi ordinity netiko on ye can say maame na was so wo normal delivery ye hospital anterior because if to anterior was say ne occiput no eba maame nanim si na ne ode awo but ebi akwala no ode na bodwe e na eba aha ana so ode nanim sei e no de eba
nanim so kura na ede
ana say ono emu ode ne nan jeso obi wo kura be hwe no wa cross ne nan ba akona ba akona hyemu sei ba akona pie fi maame no asisi enu ye ntimi deliver yes obi nso wo ho abekọ no abrante pa na ote awudi enimu sei ote ayi baby obefa aba na ote ho ote wo sei
so no dey one be pilot dey o sit for no dey hey na sa na ya na nkwa na mu di ago too much na we fi no ho ana say there
my presentation
wow
no adopt position ope
sure
etu le bia obi wo ho abekọ no abobọ ne nan sei abobọ ne nan na ote awudi enimu ote awudi enimu sei nti ono sa no bridge presentation bridge ni mpo ye wo mu ahodro obi wo ho abobọ ne nan sa na ode ba akọ ato ba akoso e na ba akọ na apia fi maame na ase enti ni na utimi
musakra no utunso betumika the way say the na ba akoko achi ba akoko na nim no de obetumika wow yes please enti yes abofa no ba but wa ma no kwan paso a
ba no kwan paso
ebehia se na saadu munni technique bi a mo te say bi a sabe maame na sentimi mi a mutimi yeri bibi na ebi ana monya na we
yenye enu de ye ne sam ebia na ye ho akọhye ye wo bibi e friend external cephalic version me kan external cephalic version na ye say obetimi adane no but ni na ye ana dangerous
okay na yanko
yeah entini na ye de ye hwe na ya ye ho achu
okay
yes please efinso ebia na akola no odi ni say no de ba transverse into transverse no enu ni yes please
wow a transverse no ono say the diver ono so be swim no dive hey